Hi, everyone. It's National Nursing Week, and we have Nurse Kyle here from the Tripod team. Hi, Kyle.
Hi, how are you?
Great. How are you?
I'm good.
Good. Today, we're going to talk about all things nursing. So I wanted to bring Kyle on today just to talk about her career, what she finds rewarding, any challenges that she faces, and then some experiences. So the first question for Kyle is, what made you want to pursue a career in nursing?
So I kind of fell into nursing it's not funny, but in a different way. It wasn't my first choice. I went to university and I have a degree in agriculture and environmental studies. And so when I graduated, there really wasn't a ton of work. And so I thought, what can I do, and it was nursing that I picked. We have a lot of nurses in our family, and I thought that's something I can do. I like the science aspect of things. And I also, originally thought I would do outpost nursing, like in Northern Ontario or way up. But that sort of led me to the nursing path.
Great. Yeah, I know. Nurses come from all different areas, so that's really cool. How you thought you were going into one direction of a field, and you ended up in nursing.
Very different, but
Yeah. And what about fertility nursing? How did you get to that point?
I worked in the hospital for a while, and it just really wasn't my jam to do the shifts and all that stuff. And I did a mat leave that lasted 10 years in fertility. The person I took over for never came back. And so I really built my career with a particular doctor who really was an innovator in IVF, like in Toronto when it was all beginning. And so I worked in his office, but I worked really, autonomously. I did ultrasounds, I did inseminations, I did all sorts of things. So it was a huge, interesting learning curve for me. When I worked in the hospital, I worked in orthopedics and immunology. So totally different shift, to prenatal, fertility, the whole gamut. So I was really exposed when I changed jobs, and clearly I loved it because I've, been here, I won't say how many years, but many years later, I'm still doing the same thing.
Great. What would you find most rewarding in all those areas?
I think it's being able to help people, being able to, fertility isn't always happy. But I think there's satisfaction in helping people to reach their goals in a way that even if they're not successful, they're grateful. It's not about gratitude. It's about they're satisfied, or I don't know what the right word is, but they can, even if they're not successful, they can walk away and feel like they did everything they could. And being part of a team that helped them achieve that is really rewarding. And of course, all the people that are successful, it's very gratifying to help them build their families and reach those. There's so many milestones, when you go through monitoring, when you go through IUIs, and if you get to IVF, everything's an uphill battle. It's just like everything in life, but you kind of break it down into these small pieces, and you think you get to the top of the mountain and you go, oh, now I have to do this part, and now I have to do this part. But it's completing those goals along the way. It's sort of, adding things up to get to your total to help people achieve what they're looking for in life. So, yeah.
No, that's a great summary, and I can definitely resonate with a lot of people.
Yeah.
What would you say is the biggest challenges that nurses face?
Oh,
There's many.
Time. So many, there's, wherever you work, there's so many things to do, so many things you want to do. And, just sometimes there isn't enough time at the end of the day. And you think I still need to talk to 80, like I still need to do these things and talk to these people because tomorrow brings a whole new set of, whole new set of things. So I think for me, that's the biggest thing. I mean, our nursing is much different than, being in a hospital setting. I don't know, that for me, that's what I find one of the biggest challenges is.
Yeah, definitely. What about like describing a time that you went above and beyond as a fertility nurse? I know it's there's so many, but
Oh, I've delivered meds all over the place to people, when they didn't have something or couldn't come. I've had people come to my house for an injection. I've had people sitting in my living room when I have friends, like my family's there, my friends are there, and I have patients sitting in my living room when I walk in the door.
oh,
Coming to do an injection because they couldn't do it themselves or whatever. So, funny stuff. Those are just a few of the things that I thought about.
mm-hmm. Well, yes, you definitely go above and beyond for patients and make them feel, understood, comfortable, and just in the right setting, regardless of where it is.
Yeah, I mean, we're always trying to, they're little things and they're not little things. Sometimes little things can turn into big things, like just because we have a better sense of what resources are out there, like things that patients wouldn't think about. We have a patient that needed to get her MMR vaccine and she couldn't, you can't just order it from a pharmacy. And so I don't know, it just popped into my head that maybe she could go to a travel clinic. So I called a bunch of clinics and to find out who would do it, would they do it, what would it cost? And when I spoke to her husband, he was so very grateful because he said, I called public health, I called telehealth, nobody knows what I'm talking about. And he's getting shifted around. And I mean, why would he know how to navigate that? That's not his ballpark, right? So it wasn't such a big thing, but it was a big thing for him because it really held them up in what they were trying to get done. So I don't know, just little things like that sometimes.
Yeah, no, like you said, having that information and knowing your field and where to access all the resources is very
Yeah.
important. And if you can share that with the patients, then that's another area that they're going to welcome.
Yeah.
Mhm. Okay, great. Well, thank you so much for coming on today, Kyle. We really appreciate it. And again, happy Nursing Week.
Well, thank
You
you.
mean a lot to us at Tripod, and the patients appreciate all the time that you spend with them as well.
Well, it has been a pleasure coming on the team here.
Great. Well, we are very fortunate to have you. Thanks so much, Kyle.
Okay. Take care.
Take care.
Bye.
Bye.